A low FODMAP diet is used to treat irritable bowel syndrome, or IBS. It was created by researchers at Monash University to help to control gastrointestinal symptoms associated with this condition. These researchers have discovered the symptoms of IBS seem to be triggered by a specific group of carbohydrates called FODMAPs. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are the group of carbohydrates that are poorly absorbed in the small intestine. They end up rapidly fermenting in the gut, and this causes painful and sometimes embarrassing symptoms. FODMAPs are found in everyday food, like wheat, apples, onions, and sugar-free gum. Some of the symptoms of IBS are changes in bowel habits, like constipation and diarrhea, indigestion, nausea, excessive gas and bloating, and abdominal pain and cramping. 10 to 20% of the global population suffers from IBS, and it's more common in women than in men. It can be highly debilitating, affecting work, sleep, and even relationships. Until recently, IBS has only been treated with medications that often don't provide adequate relief of the symptoms and cause unwanted side effects. There's currently no cure for IBS, and that's what makes the low FODMAP diet an exciting possibility. The low FODMAP diet consists of 3 phases: elimination, reintroduction, and maintenance. Elimination. First, you eliminate all the FODMAP foods from your diet for 2 to 6 weeks. During this time, you'll only eat foods from the approved low FODMAP list, including things like gluten-free grains, small servings of nuts and seeds, specific fruits and vegetables, proteins, hard cheeses, and lactose-free dairy products. Reintroduction. With the help of a registered dietitian, you'll generally reintroduce the FODMAPs in a methodical manner to assess your tolerance to each one. And maintenance. As you learn more about what you can and can't tolerate, you're able to design your own personalised, well-balanced diet. Many people can return to a fairly normal diet, only having to restrict a few high FODMAP foods in large amounts. A strict low FODMAP diet is not recommended to be followed long term. Because of the high interest in this dietary option for treating IBS, there's many ongoing clinical trials and observational studies. In one short study, 15 healthy subjects and 15 subjects with IBS were provided with a low and high FODMAP diet for 2 days each, with a 7-day regular diet period in between. All subjects with IBS complained of significantly worse symptoms with the high FODMAP diet, while the healthy subjects only complained of increased gas. A recent clinical trial by the University of Michigan Health System showed more than 50% of patients with IBS had significant relief from a low FODMAP diet over 6 weeks, resulting in improved quality of life, better sleep, and a reduction in cancelled activities. According to FODMAP expert and registered dietitian Kate Scarlatta, up to 75% of those who suffer from IBS will benefit from a dietary restriction of FODMAPs with the proper implementation. If you're suffering from gastrointestinal symptoms, it's important to see a doctor first to rule out any serious condition like celiac disease, colon cancer, inflammatory bowel disease, or ovarian cancer. If your doctor then concludes you have IBS, you might want to try the dietary approach for treating it, such as a FODMAP diet. To learn more about IBS, to book a consultation, or to learn about herbs, supplements, and natural treatments, check out my website.